we're going to start with a patient that's got, and this is not a trach collar, we're very well aware of that, but they do have oxygen on. In the hospital, it'll be more of a cup-looking device that's called a trach collar to oxygenate the patient. You're going to have your suction. You're going to have it set to somewhere between 80 and 120 for low suction. You do need to hyperoxygenate your patient. There's several different ways to do that. You could either bag them. You can increase the O2 on the flow meter, which is what I'm choosing to do. They're normally on 2 liters. I'm going to put them on about 6 liters while I'm preparing my equipment, just to make sure that they do not desat while I'm doing this suction. You're going to have your suction catheter kit. You're going to wash your hands real good. Introduce yourself to the patient. Let them know what you're doing. Do your checks to make sure you've got the right patient, you've got an order, and all those niceties. Okay, now we're going to open our kit. This is sterile. I'm going to slide the package out of the way. When you open this part, you're going to see a box that you're going to need. That box needs to be kept sterile on the inside, so I'm going to pull it out. This is just barehanded, no clean gloves on. I've taken those off, so I'm just in my regular hands. And the inside of the box is the part that has to stay sterile, and the bottom of the box opens to make you a little container. I'm going to take my saline. We all know that we hold the label in our hand. We check the expiration date. If it's been opened for more than, I think they let them stay in the room 24 hours, then we'll need a new container. If it's been opened, I can also lip and clean the edge. And I'm going to come around and put me some normal saline in here. Some hospitals may let you use sterile water or normal saline. Either one's appropriate as long as it is a sterile solution, because it's a sterile procedure going into the airway. Now we're to the part where you actually open your kit, and you open them very similarly to sterile gloves. I'm going to put on my gloves. The first one is a pinch. Second one is a scoop. Whoops. See, we even have to look at this thumb over here though. What's this thumb doing? It's up. Don't let it be down. My gloves are not perfect, but this is what I've got to work with. So can only touch from here down on sterile gloves. This is your suction catheter. I'm going to take my catheter out. I'm going to wrap around my dominant hand this tubing. I'm going to have this part ready to connect. Now you're going to see that I'm fixing to contaminate this left hand. When I come over here and remove their oxygen source and connect this to suction. So here we go. I'm contaminating this hand. Remove their oxygen. Take my suction. When you connect these two, be very careful not to let these fingers hit these. And just snug it up in there really good. Remember, we've got our suction set to 80 to 120, which is a low suction. This is the part of the device that's going to do your sucking for you. When you put your thumb on it, it makes the slurping noise, the sucking, and with it off, there's no suction. These are the ends. So I'm going to come over here and I'm going to dip into the saline, and I'm going to suction. That does two things. It lubricates the end of it, and it also makes sure that my equipment is working before I get started. I'm going to go into keeping this taut, not letting this relax onto their gown. I'm going to keep it very taut. I'm going to go down into the catheter. The book says about 5 inches you're going to go in. You're going to go in until your patient is coughing or you meet resistance. 5 inches is a great parameter, but you may not make it before, and that's okay. I'm going to start the suction on the way out, and I'm twirling the catheter. No longer than 10 seconds. Don't suction on the way in, suction on the way out. It's intermittent suction with your left thumb, and you're twirling the catheter. So at this point, I need to let my patient have some oxygen. So I'm going to wrap this in this sterile hand, replace their oxygen. Let them take some good deep breaths, because when I was suctioning the mucus, I also was suctioning their air. So I'm going to come over here. I'm going to rinse my catheter, slurping it up. And at this point, you kind of need to decide if I'm going to suction them again or not. Most of the time, if I've gone to the trouble to get the equipment out, I've gotten all sterile, I suction twice just to make sure I've got them good and cleaned out. Some people don't, but you can only do it twice if you do decide to do a second time. So I am going to go down a second time, because let's just make sure we got it. We can only do this every 2 hours in the hospital. So take their oxygen back off, grab this section, straighten all this back out, go back down, same scenario, no sucking on the way in, no suction. Keep this taut, don't let it relax on their clothing. Suction on the way out for a count of 10. And replace the oxygen. Okay, I can clean this out, and I can now go into their mouth if I needed to, if I thought that it was nasty. That's suctioning. I can wrap this around my hand, cut the suction off, take my oxygen back to the appropriate setting, which is most of the time 2, and I'm done with the suction part. I'm going to put my glove over this, dispose of all my equipment, wash my hands, and then I'm going to get ready for trach care. Do you want to stop?